Even with the best care and adherence to the herd health plan, animals can become ill, require medical treatment or euthanasia, or die. Management on dairy farms should be prepared to handle special needs animals through proper employee training, segregation, and prompt decision-making to treat, cull, or euthanize an animal. When it comes to special needs animals, the National Dairy Farm Program recommends several best practices in the categories of nutrition, animal health, environment of facilities, and handling, movement, and transportation. When an animal becomes sick or injured requiring separation from the herd for medical treatment, in other words, a special needs animal, the recovery of that animal is enhanced through appropriate nutrition. Under best practice, special needs animals are not restricted from feed and water for more than 4 hours. When it comes to animal health, the producer or person in charge must determine immediately whether the injured animal is otherwise healthy and can be nursed back to health or can't be saved. If the non-ambulatory animal can be nursed back to health, protect it from further injury, provide it with shelter, food, and water, and give it care to minimize its pain and discomfort during the recovery process. To help navigate such decisions, the dairy must have a herd health plan developed in consultation with a herd veterinarian or veterinary consultant. The plan should include specific areas for non-ambulatory animal management, including proper movement, including use of special equipment, husbandry and nursing care that provides shelter, water, feed, isolation from other animals, and protection from predators, prompt medical care, and euthanasia if warranted. Euthanasia by properly trained personnel may be necessary if the animal appears to be experiencing severe pain or distress, can't be saved or moved properly, has been chronically ill, or was recently treated with antibiotics requiring an extended withholding period. Dead animals, either euthanized or expired from natural causes, are potential sources of infection. They should be disposed of promptly by a commercial rendering service or other appropriate means, including burial, composting, or incineration in accordance with applicable ordinances. Again, as a best practice, the dairy has a written herd health plan developed in consultation with the herd veterinarian or veterinary consultant, which includes specific protocols for euthanasia consistent with recommendations from the American Association of Bovine Practitioners and the American Veterinary Medical Association. The herd health plan requires training of animal caretakers on the need for and recognition of animals to be euthanized, designated animal caretakers trained in proper techniques, confirmation of death, record keeping of euthanized animals, and the disposal of carcasses in compliance with local regulations. Best practices for environment and facilities require that facilities are provided to segregate sick or injured animals and that these facilities provide protection from weather. Self-locking stalls provide an emergency release for non-ambulatory situations. Because sick or injured animals are more susceptible to discomfort than the healthy animals, it's important that the pen be equipped to maximize animal comfort. It should provide adequate shade, bedding, air movement, and accessibility to feed and water. It's important to take great care when handling, moving, and transporting non-ambulatory cattle. The National Dairy Farm Program recommends that a timely and prompt marketing plan is part of the management plan, that designated animal caretakers have been trained and proper equipment is available to move non-ambulatory animals, that special equipment for injured or non-ambulatory animals is available, and that trained animal caretakers are available when sick, injured, non-ambulatory, or dead animals must be moved. Non-ambulatory cattle that can't be carried should be moved with an appropriate sled, sling, or bucket, with the exception of cases where an animal must absolutely be moved a short distance before an appropriate movement aid can be used. For example, if a cow becomes non-ambulatory in a parlor, cattle should not be pulled, dragged, or otherwise moved through mechanical force applied directly to the animal, with the exception of specifically designed equipment for such purposes. If the animal is highly unlikely to become ambulatory again, with little chance of recovery, the animal should be euthanized and then moved in accordance with the herd health plan. Euthanasia is strongly recommended if an animal goes down in the belly compartment of a semi-trailer that does not have side doors, because humane removal is nearly impossible.